pretty common in lifting to have knee pain, especially in the anterior knee in this region right here. And so we're going to talk about a lot of easy soft tissue maneuver you can do on your quads to alleviate pain in this area. So you have to remember that when you have pain in your knee from lifting, that it's typically caused by bad mechanics or something otherwise going wrong with the actual lift that you're doing. So you have to address the thing that's causing it, but first you want to address like the pain in general. So you can do palate treatment, icing, and compressing and stuff like that. But I'm going to talk about working on certain portions of this soft tissue in this region in the quads to alleviate tension on this area. Because when you have knee pain, you always have to assume there's something wrong in the hip. There's hip dysfunction, and you need to start doing hip mobility. And one of the biggest hip flexors is the rectus femoris, and that attaches up here on the hip and comes down, comes into a common tendon with all the other quads, goes to the kneecap, and then goes down into this little spot right here called the tibial tuberosity on the tibia. So basically, if any of this stuff is tight, then it can kind of create tension here. So the first thing we're going to start with is the rectus femoris, and you can tell where it is when you flex your hip because it is a hip flexor. So you can see, you can feel on yourself when you flex your hip the contraction up in here, and that's our first spot. I like to use the Theracane for this. You're able to be much more accurate and pinpoint a specific area, because instead of just rolling across a broad area or just smashing an area with a lacrosse ball, if you can pinpoint and actually stroke in one direction and pretend that you're kneading it out, then that is just more effective at relieving tension. So this is kind of like right below the tendon attachment of the rectus femoris up here, right where the muscle belly begins. So I actually am about to train, and I usually do this before I train. So you would take it, and you can see kind of how I'm getting deep into it if you need to walk around to the side. So if you need to walk around to the side to see that, I'm getting deep in there, and I'm using my other hand to guide the end of this along. I'm trying to keep this entire thigh relaxed so that I'm not tensed up, and I would do this about 10 to 12 times depending on how I was feeling that particular day. And then so the second site is going to be down here. If you kind of look at like the lower third of the rectus femoris and kind of going right at that point at which it starts the third, and you can actually get into the Vastus Intermedialis, which is the muscle that lies deep to the rectus femoris. So I'm doing the same thing here. It's kind of hard it wobbles back and forth, so I'm trying to stay on top of that muscle, and I'm stroking just towards the knee. That's what I've found to be easiest. And this is about the speed that I would do my 10 to 12 strokes. And you can actually feel a little bit of, I don't know how to explain it, but I can feel almost like it's releasing tension already. So this next site, I'm going to go to the Vastus Medialis, which is the inside quad, this guy. So we just hit kind of rectus femoris here. This is Vastus Medialis. So you got kind of just a muscle belly head right here, and it comes down and attaches on the patella. So it's kind of the same thing. If you have medial patellar pain, medial kneecap pain, this is something that would work really well. And you can do this with a lacrosse ball too, but since I'm already sitting here, I like to hit it right here. And that's about the speed that I would do that. Now we got Vastus Lateralis, which is it's a large, long muscle out here, and you can see the muscle belly here, and then you have the IT band right here. And then sometimes, usually the Vastus Lateralis will kind of stick out a little bit underneath the IT band. So it's also interesting because the IT band integrates with this Vastus Lateralis. So releasing tension in the Vastus Lateralis can also reduce tension in the IT band along with the TFL and some of the glute muscles up here. So if you separate your entire thigh into thirds, take the middle third and then go 1, 2, 3, and those are your 3 points right here. So I use the Theracane like this. I put pressure in and I stroke down towards my knee again. So this is, I just did 3 there, moving up to my middle position, doing 3 here, and then if you want to get a little more proximal on this one, that's fine, and 3 there. The first time I did this, when I stood up, my knee pain was gone in this particular knee, and this is I get more knee pain in this particular knee than I do my left one, so hop back up. So basically, we're just working on kind of hitting the 4 quadriceps, because when you work on the rectus femoris, you can get a little bit of interaction on Vastus Intermedius underneath it, and then medial and lateral, and that's one way to start reducing tension on the knee from these quadriceps. Now, of course, there's other stuff attaching. This isn't a catch-all, but this is a good thing to start doing prior to training, because it's pretty quick. Like, I can hit the whole thing in about a minute, and then I'll go right into this stretch, which is just a couch stretch, but I do it a particular way. And if you came here for the soft tissue, that's done, so goodbye. But if you want to see how I would do, how I would use the couch stretch, I count to 30 just in my head, not full seconds, but every time I hit a tens mark, I would just contract this glute over here, so that I'm like contracting 1, 2, 3, 4, 5, and then releasing. So I would just count to 30, and then I would go to the top position, and I would do the same thing, counting to 30, lower abs are tight, and then on every 10 or 20, I'm contracting for 5 seconds with this glute as hard as I can. And the soft tissue work prior to doing something like stretching is going to help those muscles stretch better, because you have worked some tension out of them. So give that a try if you've got some knee pain.